Hello, welcome to the Healthcare and Elders Not for the Weak of Heart webinar. My name is Jackie Deveneaux, and I'm one of the co-chairs and founders of the Green Party Elders. We formed this group in hopes of giving a space for the elders of this party to be able to share what they are facing, as this aging thing came with no handbook, and we would like to be able to have a safe space for elders to work on all the issues facing us. Can we make sure that everybody has got their sound off, please? Where did I leave off here? Sorry. For the elders to work on all their issues facing us. Also, to help educate and share with Greens who have yet to have reached this stage in their lives some info that might be helpful when they too have to tackle all of this. To that end, we plan to do a webinar series around healthcare and elders. So today we are starting with what we are calling Not for the Weak of Heart. The webinar will be facilitated by our other co-chair, Jim Becklin. So I will turn this over to Jim now. Thank you.
Thank you, Jackie. We're certainly going to have an information-packed session today. But first, we'd like to acknowledge that we are gathered on the ancestral homelands of the indigenous peoples in our respective communities. We honor the original ancestors of these homelands and offer respect to the diverse indigenous communities who have made their homes there today and in the future. Today we have 4 speakers who have faced the healthcare system in different ways, from treatment to practicing caregiving. Our speakers are Barbara Laxton from Pennsylvania, Skip Mendler, also from Pennsylvania, Mary Sanders from Connecticut, and Gloria Matera from New York. We will be starting with each speaker talking approximately 8 to 10 minutes. After that, we will have a chance for you, the audience, to ask any further questions of our panelists. Please mute your mics until that time. Please keep your questions short and to the point so that we can fit as much we can fit as many of your questions in as possible, sorry. Also be respectful of the speakers. We hope you learn and are better informed about our healthcare system. At this time, I have the pleasure of introducing Barbara Laxton. The floor is yours, Barbara.
Okie doke. So, okay, I'm going to start with a little backstory. Okay, I've always been an advocate for universal health care. And part of that was because I had seen what my mother went through trying to stay on welfare so that we would get the supplemental food and could have a decent place to live, which didn't always happen. Even with the money that we received from the state, it was never enough. But we did get Medicaid, and that was good. So I assumed that when I was eligible for Medicare, it would work pretty much the same way, that whatever I needed would be covered. But, I've been, like the rest of us, paying into for Medicaid from my paycheck for my whole working life since I was 16 years old. Okay. So then when I became eligible for Medicare and learned that I would have to continue to keep paying for it, I was pretty upset. And I decided, since I had most of my life, I've been pretty healthy and I eat organic food and so on, that I would be fine, and I refused the Medicaid. Well, Then in June of 1921, I was diagnosed with cancer after living here in Bradford for about 5 years, where there's wells on every other street and an oil refinery in the center of town. So then I went to I was referred to a cancer specialist and an oncologist, and he said that he would not treat me because I did not have Medicare, and that even though I had quite a bit of money at that time because I had been working and making good money, and I was willing to pay a pretty good portion of it up front. But he said, no, it by the time the treatment was over, it would be too much money, and he would not begin the treatment without, my having any insurance. And I went to my local hospital, and they said that, according to what I was, making and whatever, that they would pay up to 50 or 60%. But the doctor, I'm in Pennsylvania, and the nearest oncologist is across the border into New York. And he said, no, just no, he would not treat me without Medicare. When I tried to get on Medicare, they told me, well, I had already passed the date for that year because I had to apply in January. So I had to wait to the following January in order to begin to receive care in July. So I spent all of my time calling every agency out there that dealt with cancer or healthcare. Everybody would give me 3 or 4 different people to call, and I'd call them and they'd give me 3 or 4 different other people to call. But everybody I called basically told me the same thing. I'm too old to get regular insurance. And, since I can't get Medicare, oh, well, that's, their hands were tied. There was nothing I could do. And if I dropped dead in the meantime, well, there was nothing they could do, So after about 8 or 10 months of calling all of these different people, I finally found some people that were a 3-hour drive away that said that they would in fact treat me even though I didn't have any insurance. So I was driving 3 hours away to go to see the doctor there. And when they put me on the plan where I had to be 6 weeks receiving daily radiation, they allowed me to stay at what they called hospitality care. So I was able to stay at the hospital, kind of like a hotel room, and be responsible for my own meals and whatever, I needed. And then they wouldn't give me Medicaid either, because Medicaid said that the $1,400 a month that I was getting from Social Security was over their limit, so that I couldn't get Medicaid either. So, this is where I was. So I'm not really good at this, but anyhow, so in January, I subscribed of 22 and got on Medicare starting in July, when I didn't need it anymore because I had already been treated from January to March. So basically, I guess that covers everything that I wanted to say. And if anybody has any questions.
Okay, well, thank you, Barbara.
So you're in remission, huh? Or actually,
Well, the last time I visited a doctor, they said that they saw no sign of the cancer. But however, I forgot to mention that the radiation and chemo is actually left me in worse condition than I was when I had the cancer. It was a rectal cancer, and my bowel issues are actually now worse than they were when I had the cancer. But they told me, well, at least you don't have the cancer and you're alive and looks like you might live a few more years and you don't have pain. So, oh, well, if you have to go to the bathroom every 10 minutes and wear diapers when you go anywhere, oh, well, that's, too bad.
no pain?
Yeah, no pain from the cancer type pain, just pain from all the sores from the radiation and wearing diapers and that kind of thing.
I have two questions. One, do you think that the delay that was caused with your trying to get treatment may have made the aftermath worse? Secondly, where was the hospital? What was that hospital that treated you and allowed you to stay there?
It was in Williamsport hospital that I stayed at, and it's very possible that the delayed treatment may have been responsible. I don't have any really way of knowing. I was told by the radiation doctor that very often, because the cancer was in the sphincter muscle, and that's what they had to radiate, and that would probably destroyed some of the muscle, and that I may be stuck with those issues for the rest of my life.
I see.
We want to make sure that we get all the speakers their time to speak. So we're trying to save your questions for after everybody gets done speaking. And by the way, thank you, Barbara. Very informative. Next to speak is Skip Mendler. Skip, the mic is yours.
Thank you very much. And good afternoon, everybody. I'm not too far, actually, from Barbara. She's in Bradford, and I'm in Wayne County up here in northeastern PA. A few years ago, when all this stuff started happening about Social Security and Medicare having a funding problem, people were starting to sound the alarm that there won't be enough money to go around and so on and so forth. And I started to wonder how many of us baby boomers would have to die early, before actually drawing any benefits from the system in order to make things balance out. So I started asking around, and I couldn't get anybody to give me any hint about what the answer to that question was. Finally, a few years ago, I found somebody affiliated with a very prestigious university in the Western United States who had been researching this question. And they said, well, I'll tell you, but you've got to promise to never quote me. Just never quote me. No, I haven't. But it's a very simple math problem that, as you probably know, the system is based on people who are presently working, paying money into the system, which then goes to pay the bills for the people who are not working anymore. And so as the baby boomers, that's us, make their joyful way through the cobra, as the hamster goes through the snake. Well, it works out that the answer to my question was about half. About every other boomer would have to die before benefiting from the system to make it all work out. Now, one wonders if that would be the case if, say, the minimum wage had kept up with inflation and such, or if that famous cap on which part of one's income is taxable for Social Security and Medicare purposes were to have been raised back in the day, but that's another discussion. But the upshot has been a great lack of funding for the this kind of work. And if there's ever been a growth in, oh, I'm sorry, I'm getting ahead of myself. I should explain that I've been making my living for the past 2 or 3 years as a caregiver, doing at-home healthcare. Home health aide, I guess, is the formal name of what I do. And surprisingly enough, we're very, very short-staffed. It's very hard to cover all the demands that we have for people, and of course, not just in the home healthcare field, but in nursing home staff, therapists, physical therapists, occupational therapists, and all the rest. And of course, we're well familiar with the propensity of insurance companies to deny coverage or to stop coverage of a certain service, usually about the time that the benefits of that service start to really kick in. I'll give you an example. I have a client, or had a client, he just went back into hospital, but he had had a auto accident several years ago, and this led to a lot of consequences, and including heart failure. He had stents put in, and an awful lot of edema in his legs, open sores. He's a mess, basically. And he had gone back into a nursing home about 6 months ago, and they didn't help him. They couldn't help him. They didn't have enough people to give him the therapy he needed. So he checked himself out and came home with zero support mechanisms in place. And my company and other social service agencies, responded as quickly as they could, but he just did not have what he needed. He didn't have the right equipment. He didn't have the right personnel around him. He had an apartment, but couldn't get his wheelchair through the doorways to the bedroom or to the bathroom. And so he'd keep trying to get up and fall over and have to call 911. The EMTs were starting to get kind of tired of that. So he eventually did manage to get back into the hospital. I haven't heard yet what the next step is going to be, but it's just an illustrative example of you can write that times a million at least. And we have to remember that this is a big. I talked about the hamster going through the snake. We are one big bolus of people. This is one big mass of hope. I just saw a statistic today as I was doing some reading up before giving this talk. By 2030, all the baby boomers will be over 65. So that's a huge figure, and we're not ready. We are just absolutely not ready for that in any manner, shape, or form. Resources are not being allocated. People are not being trained. People are not getting the idea that this might be a good field to go into. I don't know how well that that sort of thing is encouraged by our high school guidance counselors and such, but it's going to be necessary, and it's going to be a pretty big mess if we don't do something about it. I think we tend to measure life expectancy, but what we need to be measuring is what I would call thrive expectancy. To what extent, how long into our old age are we actually enjoying life? How are we able to participate and have a fulfilling existence? I think it would be extremely interesting to get a measurement on that, because I know a lot of my patients, my clients, spend their days watching the telly, and a lot of them spend their time watching Fox News, which is not conducive to mental health at all. And it just gets worse and worse, repeats on itself. My lovely wife, I remarried a couple of years ago. I had gone to Europe in 2017 following Trump's first election, to among other things, do some volunteer work. And I met a German woman who was also working with refugees and such. And I managed to talk her into marrying me and to coming to the United States. And you can imagine that she has had very choice opinions to express about the American healthcare system. And, Germany's not perfect either, as it happens. There's no utopia out there, but we have a lot to learn from our friends overseas and from, in fact, the rest of the civilized world. I want to just close by sharing a piece that I saw yesterday, I believe, that someone sent along, Charles Keener, if you know him, and it is apparently by Jim Hightower. I'll just read this real quickly. Ailing seniors need dignity. What's wrong with us, our nation's moral compass? I don't like being a downer, just focusing on wrongs, but some wrongs stand out as morally abominable, such as this one. It's about hundreds of thousands of our low-income elders who, toward the end of life, when they're frail and most vulnerable, find themselves cast into a part of the Medicaid system that has been deliberately structured by Congress to subject them to needless deprivations and daily indignity. These are our loved ones with serious health problems who need long-term care in nursing homes, and 2/3 of them rely on Medicaid to cover their costs. To get this benefit, they surrender all their income, which goes to defray their nursing home expenses. Of course, for a decent existence beyond mere survival, we all rely on a few little things that are basic to our humanity. The government authorizes each state to set a monthly personal needs allowance so elderly patients can cover their hygiene and grooming products, a book or CD, a small gift for the grandchildren, a chocolate bar, etc. Good. But then Mr. Mingy walks in. In 1987, Congress set the minimum for this allowance at a mere $30 a month, under $8 a week. Congress has not raised it in the 36 years since, and most states still provide only a pittance, despite inflation and monopoly price gouging on practically everything. So our state and national leaders, who freely dole out massive corporate subsidies and tax giveaways to billionaires, are leaving ill seniors with so little spending money that they must ration their toothpaste and scrimp pennies to buy a rare treat from the vending machine. I know that this is small in the global scale of human indignity, but that makes it an even bigger moral failure for our society. It would take so little to do so much for so many. And that's from Jim Hightower. So glad you all are here. I'm looking forward to the discussion. And as they say in Congress, I yield back.
Thank you, Skip. Everyone, remember to save your questions until after the speakers are finished. Up next is Mary Sanders. Take it away, Mary.
Hi, thank you all for joining us. My name is Mary Sanders, and I am part of the Green Party of Connecticut. I'll tell you a little bit about myself. I'm born and raised here. I officially joined the Green Party in 2016, although I had often voted Green, but I finally got fed up in 2016 and officially did the Dem exit. I worked in social services all my life. I grew up in a low-income family, so I also had the Medicaid when I was young and didn't have to worry about it. But when I got married and had a family and started working, my insurance was kind of spotty because I was working in a lot of small nonprofits underfunded traditionally. For the last 20 years of my career, I worked at a very small nonprofit, and there were years we had insurance and others we didn't. And the clientele we were serving in our food pantry and education programs and case management really opened my eyes to the inequity in our healthcare system. Our agency became involved in the universal healthcare movement. There's a universal healthcare foundation here in Connecticut that we, partnered with, collaborated with to do different activities. And I have always, worked for equity and taking care of the basic needs of our communities. So I was exposed to, I saw a lot of opportunities for improvement in the system. We dealt with a lot of seniors at the food pantry and in our case management program, and trying to help them access the benefits they needed was always a nightmare for our case managers. For very low income people who qualified for Medicaid, in addition to their Medicare, it wasn't as bad. But for those in the middle income bracket, where they were just over the income, they really struggled to get their medications and to have their co-pays and get transportation. When we saw the system switching over and becoming privatized, there were many brokers who wanted to come into our agency to talk to the clients about the benefits of the managed care program. So we allowed that. We wanted our clients to have access, and it wasn't until much later, a few years later, that my eyes opened to the fact that, the government was pushing this into private companies. The companies were on a, race to the bottom, actually, trying to offer more and more benefits to the people who are going to sign up for their programs, but at the same time, draining the federal government, charging them more and more money so that they could provide these services. I agree that the Social Service Administration that is not in a position, is currently at least, to provide managed care like the insurance companies do. But I'm sure the cost to the federal government by all these companies whose bottom line is to please the stockholders is not sustainable. Recently, I read an article about Medicaid and Medicare benefits both being slashed in Puerto Rico by up to 80%. That healthcare system is already falling apart, and to impose those kind of cuts there should give us warning here in the States that if they can do that to their, properties or Commonwealth or other islands that they're supposed to be partnering with, in the next minute they'll turn around and do it to the states, because the bottom line is going to be to satisfy those companies, those insurance companies, and the doctors and the hospitals as these costs continue to rise. My own self, I've had spotty insurance through the years. My first year, I lost my job because I was laid off. I was not allowed, I didn't retire traditionally, but I was laid off at the age of 63. And it was the whole office that closed. So I wasn't the only one let go. All 5 of us were let go. My first 2 years, I had absolutely no health care. So I started going to a community clinic. And luckily, because of their grants and because of my income, I had collected for 6 months, and then I reluctantly applied for Social Security at the age of 63 and a half, taking a big hit. My visits were only $20 a month. As soon as I turned 65, I started getting bombarded with all kind of offers for all different insurances, and I just kind of ignored it because I was going to the clinic. But then I received notification from the Social Security Administration that they had placed me, in fact, on traditional Medicare, and started deducting $134 a month from my already meager Social Security check, and it was unanticipated. We had gotten, I think when I started getting Social Security, it was like $1,100 at that time, and then it dropped down to 1,000 and some change when they started deducting the premium. So, you know, I was struggling to survive with that, and I rarely used the Medicare because of the high copays at the doctor's offices, and because I didn't have money for transportation to get around, and I was just struggling to survive. So I neglected my health care as far as going anywhere outside of that community clinic just to get my blood pressure medication. But any other care, dental care, vision care, anything else like that, I was not getting. So the following year, when I got bombarded with all the offers, I spoke to an independent broker who presented me all the plans, and I ended up choosing United Healthcare. And I have to say that for me, it has worked. I've been able to, you know, have the transportation to my medical visits. I still have co-pays if I don't go to the hospital or to the community clinic. So there's some limitations there with some of the specialists outside of the hospital. But because I'm low income, they also started waiving that 100 or however much I'm sure it's much more now, the premium fee from Medicare. But so that money was re-added to my benefit. So it has turned out very well. I had colorectal cancer in 2019, and I was able to get transportation back and forth for my chemo and radiation. They didn't deny any of the medications. I've needed other treatment. I've needed physical rehab after a fall 2 years ago. I went for 3 months of PT for my knees, and they got me back up and mobile. And once in a while, a doctor will say, "Oh, I have to check and make sure the insurance will cover that." But there's rarely been any questions, and it has worked for me. What distresses me most is the fact that this competition that they have amongst themselves, and they keep offering more and more and more benefits, and that's just going to drain the pool of money. And those people who are left outside of that, if they're really low income, they're covered by Medicaid and Medicare or get some kind of assistance. If people are on the upper end of the income bracket, it's not that much of a problem, but it's that 70 to 80% in the middle that is suffering so bad. A friend of mine had a stroke, and because she can't get the care she needs at home with traditional Medicare, she's in and out of the hospital all the time. She's in an assisted living right now when she could be at home if she had the care she needed. Our politicians are taking too much money from the healthcare system, and they're in cahoots with the insurers, and we need to get money out of healthcare. We need Medicare for all and improved Medicare for all. When I ran for office the past couple of years, I signed a pledge, and I hope we will hold all of our politicians to not take money from the healthcare system, and to really start thinking about how to improve our system, to look at what's being done in other countries, including Cuba, who, by the way, who has one of the best healthcare systems in the world. And I know I saw my 2-minute warning, so I had other things on my list I wanted to talk about, but I guess we'll leave them for session number 2. And I will turn the microphone back over to our co-host. Thank you.
Yes, thank you, Mary. Very informative. Last but certainly not least, I give the floor to Gloria.
Thank you, Jim. Hi, everyone. I'm Gloria Matera. I'm currently co-chair of the Green Party of New York. I'd like to say one of the most important things that we can do in this struggle that we're in to have healthcare justice for everyone is to really listen and share and publicize the stories that many of that we've heard from Skip, from Mary, from Barbara, because that really what touches people's lives, and other people can relate to that. And there actually are organizations that are collecting healthcare stories. Maybe I can share that later, or to the caucus, and they will know, share that with others. So I have been working over 30 years in the public hospital system in New York City. And that was my introduction. I used to be a special ed teacher, so I then started working with children and families, mostly undocumented, under the fairly low socioeconomic level at the hospital. It's a public hospital who serves everyone regardless of the ability to pay. Many of them do not have insurance because of their status in this country. And soon after working there, even though we gave great care, pediatric department was really wonderful. There was lots of support from social work, child life, which is my profession, nurses, doctors, really caring people working, for the public good. You can see that still the system that the patients were in were just, delaying their health care, not providing what was needed. Someone's already talked about the gaps that happen. It's not only in Medicare, but it's in other kinds of coverage as well. And I realized that this was a system that was broken. It only cared about profit. It didn't care about the patients I was working with. And so I started reading about what you could do. And that's really when I came to the single payer healthcare movement. And since then, for many years, I've been a board member, a non-physician, board member of the Physicians for a National Health Program, which is a national organization. We have a very active chapter here in New York City. But I also realized a few more years after that, particularly when there was a quote unquote Clinton healthcare reform, which we know what that created. I said this political system, the two-party system, the capitalist system, is a system that's never going to provide healthcare justice for everyone who lives here. And so that's how I came to the Green Party. And I've been here for 20 years, over 20 years. And healthcare advocacy is still a big part of either when I've run as a candidate or when I have done programs and things around the community about why what the Green Party puts forward is a more just way of healthcare. So I'm just going to talk a little bit about single payer national health insurance, which we have all also known as Medicare for all, but we're talking about, and I think Mary mentioned it, it's improved and expanded Medicare for all. So to us as single payer advocates, it's a system where a single public or semi-public agency organizes the healthcare financing. So for instance, the government or an agency, public agency set up is going to be like the insurance company. There won't be any other insurance companies, no for-profit insurance companies. Delivery of care is going to still largely be private in terms of the doctors, the hospitals, and all other healthcare professionals, are working under, what their practice is, right? Unlike England or some other countries where the medical providers work for the government. So under a single payer system, all residents in the United States would be covered for all medically necessary services. So you don't have to be a citizen. We're talking about people who are residents, and that includes doctors, hospital, preventative care, long-term care, mental health, reproductive health care, dental, vision, prescription drug, and medical supply costs. Everything everybody needs. I'm getting thumbs up from Barbara. And so the program that program would be funded. People will say, well, how are you going to pay for that? How could you cover everyone? Remember, not only is this going to be publicly funded, but it's also going to be publicly administered. In fact, that there is a transparency and there is an oversight that's built into the system as opposed to it being private and often secretive with hidden costs. The program will be funded by currently some of the resources that are public funding now, like Medicare and Medicaid. We won't need those in the same way. And then there will be some modest new taxes that will be based on the ability to pay. And research shows over and over again that there will be $500 billion in administrative costs saved by replacing this inefficient, profit-oriented multi-insurance payer system with this streamlined nonprofit public payer system. And that 95% of households would actually be saving money. It would be just the very high income earners that might be paying more than they pay now. There'd be no premiums. There'd be no financial barriers to care, no copays, no deductibles. People would still be able to have free choice of doctor and hospital, and doctors would remain autonomous over caring for their patients. And so Medicare, as it stands now, with some of its flaws or some of its gaps, is already a public nonprofit social insurance program. That's traditional Medicare, right? It gives beneficiaries free choice of their doctor and their hospital. It reimburses at a set rate. And because its simplicity of being administered by a public agency, 98% of the funds are on patient care, 2% are in administration. And so one thing I'd like people to note, that the Medicare for All Act of 2021, HR 1976, that is a bill that you want to push your elected officials for, that you want to organize around, because that would establish a single payer healthcare system. Now, because healthcare in this country is profit driven, and Wall Street's always trying to find ways to make more and more money through the system, while private hospitals and insurance companies and the government keep trying to cut services, there has been a continued threat to privatize Medicare. And that's already been happening. The first part of that was, and some of you already know, or maybe have been a part of this, is the Medicare Advantage, or what we call the Medicare Disadvantage program. And that's mostly run by commercial insurers for profit. And people get pushed into that. It's costing taxpayers more. It's costing beneficiaries more. And it's really kind of a boost to private insurance. People enroll in that, sometimes unwittingly, sometimes they have no other choice, and sometimes, if you see, it's a huge marketing campaign on television. My own parents were in that program, which I never knew until they became too ill really to manage their own health care, and I was faced with dealing with that while I was trying to get them in hospice, nursing homes, and the like. So what is the latest threat that's happening right now? After Medicare Advantage or Disadvantage, it's called it's the DCEs, and this is called the started with the Center for Medicare and Medicaid, happened right at the end of the Trump administration. It's called Medicare Direct Contracting, and that allows profit-hungry middlemen, right, to manage your health care. What it's doing is taking people who are in traditional Medicare and putting you in this other program, a direct contracting entity. A direct contracting entity is the middle person between you, right, and your provider and Medicare. And so that could be a private insurance company. It could be a hedge fund or any other kind of Wall Street profiteers, right? So it's now become a business. And already they have enrolled over 1 million beneficiaries who are receiving traditional Medicare, right? Straight Medicare, not the managed one. There's a huge influx of money in this to be able to make money. There was a groundswell of support and in terms of trying to push this back, right? People, activists, doctors were trying to expose the DECs for what they really are, which is just a for-profit entity. So the Biden administration had to turn around and make a decision because it was so unpopular that the insurance companies were not going to get away with this. So they decided to rebrand it. And now they call it the REACH program, which I'll tell you, let's see if I can find, but that it's something like really depressing, like, you know, kind of about equity and community health, actually everything opposite of what it really is. So Biden had a choice. His choice was to really enact a single payer system, to move towards covering everyone, to make a move towards health justice. But he decided that instead he would just change the program that people were able to fight against and institute the same thing. It's called Realizing Equity, Access, and Community Health. So it's REACH. And this is the same thing. It actually has all the same awful qualities that the other one does. The main points of it's already happening. They've enrolled people unwittingly into this. The way you get enrolled is that if your doctor joined into one of these programs, they'll just put you in it. It doesn't matter that you have traditional Medicare. Know that the people managing it are private insurance companies, investors, so it's a for-profit system. The incentives are that they give the direct contracting entities a sum of money, and they could keep 40% of that sum of money and that they didn't spend on patient care. So that encourages two things. One, because the sickest patients you get more money for them, is to what they'll call in the industry upcoding, but we will call fraud. They will say that someone has a higher degree of illness than they have, than they've actually presented with, so the reimbursement will be more. And then if you treat less patients or give limited care, there's leftover funds at that period of time, which then the company can keep. So they are making a profit by cutting patient care. This is not new. We know this. This is what's been going on. But every time we push back as a society and talk about healthcare justice and we win that battle, there's another for-profit way in the back door that they come and try and take that away from people. And this will have no oversight over Congress. The Center for Medicare and Medicaid can make those decisions and award companies these to be a direct contracting entity. So I don't know how much time I have left. Just want to talk. So I think nationally, that's really important for all of us to know about and engage in what's happening around that. Just quickly say locally in New York City, we know all over the country, unionized workers, often they have to fight between healthcare benefits and wage increases. We know that corporations know that they would be saving money if we had a single payer system, and there are reasons why they don't want that. They don't want a social safety net like that. They don't want something publicly owned, publicly financed. But here in New York City, recently, the retirees and the municipal workers, they have their healthcare as part of their pension. They're in Medicare first, and their secondary is free, no copays, no deductibles. They can see the doctor of their choice. The city made a decision that starting in 2022, that $600 million every year needed to be saved for healthcare costs. That's what we hear all the time. Healthcare costs out of control. They're affecting wages. People can't get raises if you're going to pay for their healthcare. We know that's not necessarily true. And so the retirees would now be pushed into Medicare disadvantage, as we call it. But there was such a huge fight back between retirees from all the municipal unions, some political people, a lot of healthcare organizations. They were able to put that on hold. The insurance company that they were going to bring in backed out. But just recently, a new company came in, Aetna, with a policy. 25 unions voted against it. There's one committee that decides all the healthcare benefits and negotiates that for all the unions, over 100 of them. But so many unions supported it. The leadership of some of the biggest unions, teachers union here in New York City, support this idea. Whether they believe it will really save money or their other interests, it's hard to know. But right now we are in a position where the mayor can make a decision about how this program will go. And there has to be a decision April 1st. There's still lots of seniors, retirees, city workers fighting back on this. And so what I'd like to conclude by saying is definitely check out Physicians for a National Health Program. Their website has loads of information, particularly about what you can do nationally. See what's happening in your state. New York does have a fairly robust campaign for New York Health, where we're trying to get a statewide single payer system. It's a bill that's been around and gets lots of support, and then we have to renew it, of course, every time. I know other states have tried that before, Massachusetts, Vermont. Usually the public option gets watered down or taken off the table. But as Greens, healthcare justice advocates, we need to fight for that. If your local Green Party can connect with some of the other health justice organizations kind of locally, those are great places to have our candidates talk about the importance of health justice and single payer Medicare for all. Is also a great place to recruit candidates. I think that those movements and what our party stands for are really synergistic, and they are great ways to form alliances, I think, and to fight back, because I think we have to continue to say we need expanded, improved Medicare for all, cradle to grave, everybody in, nobody out. Thank you.
Thank you, Gloria, and all the other speakers. Marvelous, marvelous, really marvelous presentations. We hope everyone has learned something from each of them. We will now be opening up the webinar to individual questions you may have for any one or all of the speakers. If you have a question, raise your hand. Use the reaction button like this, and it says raise your hand. That works best. Let's see, yeah, and your questions will be taken in order. Keep your questions or comments as brief as possible, so the speaker that you're addressing your questions to has a chance to answer them. We're open for questions now. Starlene?
Just, can I say quickly, just before Starlene, someone is, Dia said that, Gloria, would you put the bill information in the chat, and maybe the PNHP in the chat as well?
Yeah, actually, that's what I wanted to ask was the number of that bill again. You said that we should support.
Yeah, I just want to mention that Holly will be our chat manager, who will be taking the questions in order.
Skip is also, you're also asked to post a link to your article too. You do that.
Okay. Thank you.
There we go. I had to find all the buttons to push. Yeah, I'm looking for for a web reference for that now. I'll post that as soon as I find it.
Was I supposed to call on people, Jim, or did you want? I was just doing the chat.
Yeah, go
Okay.
ahead.
Okay, so I see. I think Mary Lou Sanders and Starlene, then you, Jim. Mary Sanders. Unmute, please.
Hi, yeah, I actually have a question for Gloria or anybody else that might know, but I think because of what her presentation, I briefly held this up a minute ago. It's called the Patients Over Profits Pledge, saying that as a candidate, I put patients over profits, and I won't take contributions of over $200 from anyone affiliated with corporate health care. But what on the top part, it says that CEOs, lobbyists for big pharma, corporate insurers, private hospitals have formed this group called Partnership for America's Healthcare Future that wants to exploit our healthcare system and make money off of keeping us sick. Now, this Partnership for America's Healthcare Future, I've not seen referenced anywhere else, and I was wondering if Gloria was familiar with that or anyone else.
I'm not, Mary. I'm definitely going to take a look at that. But thank you for bringing that up. And I do know of the pledge. I'm glad that we're pushing that out when people are running for office.
Lefty, Starlene, I think you were next, and then Jim. Starlene.
Oh, sorry, I already got what I needed.
Okay, Jim, go ahead.
My card.
Yeah, I've got a couple questions real quick. First one is for Barbara. You mentioned the area that you lived in had a lot of oil wells and refineries. Do you feel that these oil wells and refineries could possibly have
Yes,
some influence on your cancer?
yes, absolutely.
yeah, unfortunately, a lot of areas like yours find that happening. And the other question I have, real quick again, for Gloria, in your group, have you considered promoting cutting the military budget as part of the paying for the program?
Physicians for National Health Program doesn't talk about that. They just talk about what the current spending is, that there's more than enough money being spent on healthcare. It's just going in the wrong places. But of course, as a longtime Green eco-socialist, I support the eco-socialist Green New Deal, who does talk about cutting the military budget. So, yeah.
Thank you.
I should mention that Barbara's area is, of course, the area that was made famous by Josh Fox's film Guest.
I'm sorry, what?
I said your area was the area made famous by Josh Fox in Gasland.
No, that was south, southern part of Pennsylvania, but it's.
Timmick is near you, right?
No.
Oh, okay.
But Dimmick is they have a specific drilling that created a specific problem. Bradford is the oldest area with wells. There are wells here that have wooden casings that are from, built in 1830 or whatever. There's wells on every, like 5 blocks in every direction, there's at least one well. Some are still active in the middle of town. I mean, some are still actively pumping, some are long abandoned. And then of course the refinery has at least 1 and generally 2 flares going 24/7, even though that's illegal. They get away with it. So that's soot pollution and methane and everything else that's in the air here.
Thank you for clarifying.
You're welcome.
Looks like Gloria has her hand raised.
Oh, sorry, Gloria, go ahead. Yes.
Thanks. No, I just wanted to, I know someone mentioned earlier about life expectancy. You're also looking at more, kind of a robust way of looking at that. But someone did just share, like for 2021, if you look at a graph, which I can try and see if I copy in the chat, there is a precipitous drop in terms of life expectancy in the US. I think 76, 75, 76, and that I think is for women. For men, it's around 73. And then the next, the country after that is like it's 80 years old. And then it just continues in terms of rising. And the list is about 11 countries, most of the industrialized countries of Europe. And, I don't know what else we can point to in, a country that is rich in resources and medical technology and medical expertise. Then, and there can be nothing else except that most of the money is going for profit, and people are, it's a life and death issue. It's a life and death issue to be in this healthcare system. And as we're aging, and I think Skip brought this up, there is no reason why people can't age in place. There is no reason why it's a limited program here in New York. I think it's only if you're under a Medicaid health coverage, which of course meant you gave up everything that you really owned throughout your life, if you worked or you had a home or other kinds of things, to be able to get that kind of coverage from Medicaid. But your caregivers can be family members and they can be paid for that. But just think if we can do that really across the board, how we can have, our senior members of our family home with us and maybe have a family member or 2 family members caring for them. at home, where it's, I mean, people do need nursing homes, they do need inpatient hospice. But in many cases, it's just because they can't be cared for at home. They can't afford someone to come in to take care of them, or they can't afford what nursing homes are charged, because we know that they're also for profit. Pass.
I see Sandy and then Skip. Sandy, go ahead. Want to unmute?
Yes, Barbara, I have a question. Are you in a studied cancer cluster community?
There's been no, that I'm aware of, there's been no specific studies done on people in this area. I don't know why, but that's, as far as I know, there has not been.
So interestingly, in if I may, just for a second, interestingly, in Buffalo, there's a cancer cluster on the east side of Buffalo and the west side of Cheektowaga, which border each other, of 6. It's like 3 zip codes, and it's roughly, I don't know, 2 square miles maybe, where there are 6 types of cancer are more prevalent here in that area. And of course, it's the poor area of Buffalo and Cheektowaga, where there was a auto manufacturing plant, American Axle, which is part of Chevy. Anyway, so but then they did all the study, they had the results, and then what they came back and said, now you guys are gonna love this one. They came back and said that it was the lifestyles of the people in this community which contributed to their cancer, not anything to do with the environment they were living in. So yeah, there's that fight too. All right, thank you.
Yeah, this Bradford is considered an environmental justice area. That's a whole other long story about we're fighting the well plugging and issues and stuff.
Thank you. Skip is next.
I just wanted to let y'all know about a piece of good news. There's a group in our area here in Wayne County, PA. It's called Growing Older Together. It was started by a number of elderly women in the local Unitarian congregation. And it's kind of a mutual aid thing. People give each other rides or other services, or help each other out in various ways. And this is something that's been going on for several years. I think they have goals having to do with shared housing and just setting up a more self-sufficient group of seniors that help each other out as much as they can. Of course, bringing people in as they get older as well. So I think you can find that on the web under Growing Older Together, and then you will probably find that. So it might be reassuring for some.
I see, Mary, did you take your hand down, or you have something else to say? I'm sure I have plenty more to say, but.
No, I always have plenty more to say, but I just, that Skip's comment just sparked something in my mind, and I wanted to ask Barbara if she ever heard of a group in her area called Neighbors Helping Neighbors. Because a friend of mine went to live there a few years back and helped start that program up. She recently returned to Connecticut, but I thought she left that program, Neighbors Helping Neighbors, in Bradford, PA. So I was wondering if Barbara heard of it.
I've heard of a group called Neighbors Helping Neighbors, not here in Bradford. There's a group. It's called Helping, has something to do with the pandemic, helping people survive the pandemic, or so, I don't know what it's called. But I'm not aware of any group called Neighbors Helping Neighbors around here. I've been here for a little over 6 years, maybe 6.5 years.
Gloria, I have a question for you, more of a comment, but I noticed when I had signed up, and I was lucky that I had savings that I could actually get on traditional Medicare and get a good supplement. So I was more fortunate than some, although what I'm finding is that they don't cover everything. And there are some very odd things that they don't cover, like glasses and, and sometimes doctors will, I was told that, well, when you come in, you're going to need a tetanus shot and Medicare won't cover it unless you have a cut. And you probably will have a cut before you come in here, will you not? And we laughed, I said, yes. But I noticed also, and I signed up for Part D, which is medication. And I had signed up through Aetna only because my brother-in-law knew somebody and I could sign up. I hate Aetna, but beyond that, I was trying to find information and discovered that it was, it had been moved to something under CVS and you had to sign up for something there and then something else there. But there was nothing on any website or anything that told you this. Only when I finally called customer service and somebody said, oh, you have to sign up at this other place. And seeing the encyclopedic listings of the various plans, it does strike me that this is deliberate. And deliberate or extremely stupid to the point where, as certain authors said, that's as bad as being immoral. I just wanted, was that your impression or what you thought of that?
Yeah, I mean, I think in those situations, it's almost like, trading on the stock exchange floor, right? I mean, this company will morph into this company, they'll come together and then they just put people in it. And sometimes it's even hard to find out. I was put in I'm working. I don't have to sign up for Medicare Part B. I'm covered under my employer's insurance. But I have to do Part A, but I also, my employer doesn't have a drug plan. That's part of my free healthcare, right? I'd have to pay for that and it's quite expensive, but Medicare just enrolled me in a drug program. I started getting bills, I had no idea. And it's not that much per month, but to be honest, I don't take any medications. Zero. I'm fortunate at this point in my life that my first year on Medicare, I don't need medications, but I still have to pay. I don't actually know why. So I think you're right, Holly. And the fact that you did the digging was important. And some people just can't do that, right? They don't have it's too hard. Right?
Well, you wouldn't know. I would say you're better off paying now before you have to, because once you have to, if you don't do it at the very first, when they have to take you, when it's time for them to have to take you, they can turn you down.
Good point. That is true. Thank you.
So it's money well spent, investment. I just wanted to thank everybody for that. I think all this stuff has been, I think it's one of the best or most informative things I have been on. It's extremely helpful. Jackie, I see your hand is up.
Yeah, I just wanted to say that it's pretty sad. I am fortunate or unfortunate as it may be to be in a bracket where here in Maine, we have a wonderful Maine Care that is a substance makes up, if you are in a certain financial bracket, you don't have to choose one of those 500 insurance companies. Maine Care will cover that for you. And it's a really good service. But I just wanted to say, when I first got onto Medicare, we have a wonderful seniors services here in the state of Maine. And I went directly to them. And I don't know how other people who are not financially in a situation. I was in a situation where they said to me, you don't have to go through this process. You will be on Maine Care and that will cover that. But all these other senior citizens who have to go through these piles and piles of different insurance companies to figure out which one is going to work best for them. And the system is set up that way so the insurance companies can make money, because, the seniors are going to just grab somebody. They're not going to know as informed people. what they should do. So it's so sad. So I just wanted to say that. Thank you.
Skip, go ahead.
Yeah, there, somebody was mentioning a neighbors helping neighbors. There is a Facebook group by that name for Wayne County, PA. I don't know if it's some kind of thing where it shows up in many different places or not. They have a nice graphic on their Facebook page that makes me think maybe it is. I don't know, but there is that. So I just wanted to mention that for folks if they wanted to look it up. Thank you.
Starling Stack.
Darling, go ahead.
I wanted to ask the folks visiting us today if you all have any feedback on what you might like to see in future webinars that we could pull together and offer, maybe piggybacking on what we started to discuss tonight. Is there anything more like a deeper dive into any of these issues you'd like to see?
I think it would help if we had, I'm sorry to just jump right in, but I think it would help if we had a better understanding if there, of how to get information on how much money our legislators are getting from healthcare industry. Because I find it sometimes very difficult to, and I'm on the computer a lot, and I'm trying to find information about the donations that my congressman gets and this and that, and I go on different websites and one has one information. I go on another, it has different information. I go on and I try to find the net worth, it's blocked out, and I'm just wondering, is there a better way to get the information and expose it?
Anybody have an answer? I'm sure there is. I know, I'm sure I've seen things like that, but maybe Skip or-
OpenSecrets.org would be my first guess.
What was that?
Yeah, no, I'm saying for a future webinar, as a topic that be included.
Yeah.
How to expose what's going on behind the scenes and use it to our advantage to advocate for something better.
Well, thanks, Mary.
What did Skip say? I didn't hear him.
OpenSecrets.org, I think the website is.
Ooh, that one's been good.
Center for
But there's-
Responsive Politics, is that what they're called?
There's FEC.gov, and that's the Federal Elections Commission. It might have that. Right now,
That will list the contributions, but sometime, but the OpenSecrets.org has got more detail.
Okay, sounds good. I've seen it before.
Yeah, the information, the truth is out there. One does have to dig.
Yeah, I dug deep enough last year and I found out that my Democratic incumbent and opponent at the congressional run had donated money through some secret PAC to anti-choice candidates in other states. But it was really difficult. It was really cloaked.
I'm not seeing anything more. Thank you for putting things on the chat. And thanks, Dee, for compiling all this. So this will all be available. I've always found the articles helpful that they've been sent out. Charles Keener, David McCorkadale had a report on what happened in Delaware. And so thanks, Dee, for putting those on a website so that we can, anybody can access those.
we do have some time left if anyone has any further questions or comments. I see Sherry put, and thank you, Sherry, something about the Cuban healthcare system, which one of our speakers mentioned is one of the best in the world. Even though we have been sanctioning them and embargoing them for the last 60 years.
And refusing every one of their offers to help educate our residents to be resident doctors. They were offered at one time, I understand, to put a medical school in Mississippi, and that was turned down.
I see that Starling, you have your hand up.
Yeah, I just wanted to particularly thank Skip. You know, I think you might have read on the chat room that I put down that I have a caregiver, and just very appreciative of her and the state for paying for it. And it really gave me the idea that, you know, we're running quite a few candidates this year for Seattle City Council. And I definitely want to talk to them about, you know, if some of them were to get elected, to somehow work that into the, you know, into the city, you know, bureaucracy, that maybe they could not only, you know, reach out to high schools and ask them to start, you know, talking to the kids about going into that field, but also, you know, maybe increasing the ability for low-income people to get caregivers, or I don't know, just something to do and make more caregivers available, you know, to seniors in the area. Yeah. So, thanks, Skip.
Very welcome, Sterling.
Jackie, go ahead. Jackie, okay.
Yeah, okay, thank you. Yeah, here in Maine, there's actually a bill that's moving forward to increase the pay for caregivers, and
yeah.
A lot of positive things around that. I will say one thing about Maine: we are very, 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 very good in taking care. We've opened up a lot of we just opened a brand new recovery center. We're very much on top of the drug thing. We're very much on top of, you know, the only thing we're really bad in right now is housing. And they're trying, but it's gotten so far away because they've allowed, at least here in Portland, they've allowed for the city to be totally sold out to the wealthy and everything built for the wealthy. And so now they're back pedaling, trying to figure out how they're going to move these not so wealthy people into the same area that the wealthy people are at. They already moved a big 250 homeless shelter out of the city and away from where people would see them, but which would make it so hard for the people that have been used to doing all of their things right here in the city.
Mhm.
So, but yeah, we are.
That's a good point about the pay of caregivers. I know mine, I think she makes about 17 an hour, maybe, you know, which isn't really great. And so that's definitely something that could be increased. I don't know what private practice caregivers pay, you know, people that pay full price, what the going rates are. But I think, you know, I mean, it's just so valuable. I mean, I think the state should give them at least $20 an hour. And plus, well, she gets health insurance, and that's the main reason she does the work, is for the insurance.
Diaz put the resource information, the link for the Google Doc with all the resources on there. And then Sandy mentions that she was a home health aide in college, woefully underpaid in the mid-90s, but loved the job, met lots of interesting people. I do recall Pat LaMarche saying one time that, and I know Maine was one state, and I know New Mexico had, the Greens in New Mexico had a proposal for a health plan in the state. And Pat LaMarche believed that if the first state, no, I think it was actually Carol, what's her face from So anyway, the idea was that if a state would adopt that, just in state, they would be saving so much money, and it would be so economically smart that all the other state governors would be in line to see how they were doing it. You know, I could see something like Minnesota, or like you said, Maine or something doing like that, but let's see what happens. Go ahead.
The other thing
Oh.
I'm also dealing with is I've been doing research into like home, senior home living. Gloria probably knows the right term for it, but I know there's these assisted living places you can go into that are like big facilities with, the cafeteria and all that. That's way out of my price range. And I doubt the state would pay for it. So I'm looking into like the home setting of that version of that. But even those are expensive. And you have to, I don't know, it just seems like those kinds of places should be available. Just any seniors that need them at, a low cost. So that's another thing that, our community, local governments can be working on, is providing more of that kind of thing. I mean, be a great way. I could see if I had a big house and I was, 30 years old, I'd love to bring in some seniors and help take care of them. And, that would be a cool job.
We have a program like that in Pennsylvania. I think I've seen
Yeah.
stories of that, where folks can open up their, I forget what it's called, but there's kind of a matchmaking service involved, almost, where you match people up with similar interests and such.
Yeah.
Great Panthers in Philadelphia back over 50 years ago started trying to match up, say, college students or young people with older people, because they all had housing problems, income-related housing problems, and it still survives. It's a national organization. I don't know how big it is, but it's still surviving over 50 years later.
Wow.
I did something like that here too. You could get grad students, a couple that would live in, part of the house and then help take care of the person. And there's assisted living and then co-housing. I don't know if co-housing it's not quite the same thing, but you've got, you do have some supports there. But let's see.
You usually need to buy an apartment or buy a condo, or, you have to have some money to buy into it.
Well, I would think the model, but yeah. Skip, I see, and then Jackie.
Yep, and then Jackie has had her hand up now for.
I'm sorry, Jackie.
While.
Okay, Jackie, I saw it. I thought you had talked, and I thought you'd been talking.
No, I started to, but then Star started talking. So.
Okay, so Jackie, go ahead, and then Skip.
Thank you. I was just trying to reply back to.
Go ahead, Jackie.
Talking about Pat LaMarche, and I was just trying to add on to that when Pat ran, she actually rode around in a vehicle that was built like an ambulance, and her campaign shirts were what do they call scrubs? Were scrubs with her name on it. She was working very, very. We at one point came pretty close to being able to get something here in Maine, but then it got sold out to Dirigo, and that's what happened. So. But yeah, just wanted to say that. Thank you.
Okay, let's see, Skip, go ahead.
I just wanted to introduce my wife, Jasmine Schwenk, here from Germany. She's been here 2 years, thereabouts. And Frau Schwenk, do you have anything that you would like to say about the American healthcare system?
Well, I come from a cultured country. That's a running gag between us, because I'm completely upset about that. I pay a lot of money into health insurance. I still have deductibles and co-pays and not an overview what costs. So every visit to a doctor, you think, should I really do it? Otherwise, I'm going to get another bill. What is actually, in my age, I'm 56, not a good idea. I should do every prevention that I can do. So I see that here, and I really wonder, I don't get it, why, when I criticize that as somebody from Germany, what is also a capitalistic country, but we have a common sense in terms of healthcare. And this common sense is something that I'm really missing here. That means it's all individual. It's all there just to make money, and that's the main goal of it. If it's the insurance company, but even the bills of the doctors are incredible crazy. Skip had a heart catheterization a few years ago, and I saw the bill $50,000. It was covered by insurance. That was not the point. But then I was like, what? And just for interest, I was looking what the same procedure would cost in Germany without having insurance. And the price was €2,000. What is $2,000 right now? So there you see the big problem in that. There are too many people making too much money out of the suffering of others, and that let others even suffer more. And when I see how many people here have no insurance, and in Germany you have to have insurance by law, that makes me very, very much thinking about, do I want to really grow out in this country? I'm not sure right now.
Can I tell the story? Very quickly.
Yes,
About
go ahead.
she came in about 2 months before we got married, and she had been here back and forth, but since she couldn't get on my insurance yet, we got her traveler's insurance, and about 2 months into the visit, she had got a case, or a month into the visit, she got a case of kidney stone. Okay, went to the emergency
First time
room.
in my life.
First time in her life, no urinary problems whatsoever. So she went to the ER here, and everything went fine, and they got her taken care of. So that was fine. But then we get this bill from we get a notification from the insurance company saying this was a pre-existing condition, and we're like, what? and we appealed it. We appealed it, and they sent it off to. They have these doctors who review claims, and this one doctor said, well, we know that it takes X number of weeks for a kidney stone to become noticeable. So probably when she arrived in the United States, this was probably there already, just we didn't know. And our next contact was to the state insurance commissioner's office, and they backed down on it, and they paid the claim. But absurd.
But that was my first experience with American healthcare.
Yeah.
And actually, it has never gotten better. I see that there are good doctors, so the quality is okay. That is not the point. But if I get these crazy bills, last year my dentist screwed me up with the wrong antibiotic, and I was sick for 6 weeks after that, with several other things that were following from that. And I got bills. And I called my dentist and I said, hey, you screwed me up. Yes, but you have to pay your bill anyway. So,
I like what the person said was living as a pre-existing condition. By that logic that they were using, it's like, well, you had blood all along. I mean, you probably had some leukemia in there somewhere. It's insane. We know what we got to do.
so please fight for me. I'm not allowed to vote in this country.
Not yet.
I'm not sure if I want to.
No, I don't blame you. Thank you.
Let's see, I see, Jim, go ahead.
Yeah, I just wanted to mention, listening to all the stories about people that have problems with their health insurance, co-pays and not being covered. I feel very fortunate. The private insurance that I have as a supplement to Medicare pays everything. I have no co-pays. I I won't advertise for them by telling you who it is. But as an example, a few years back, I was in the hospital with heart failure for 9 days. And I got a bill that said, this is not a bill, itemizing the cost of my stay in the hospital for 9 days, $130,000. And I didn't have to pay a single solitary penny. So I feel very fortunate. And yeah, and I hope that someday we can get the single payer health insurance that we all deserve and need.
You wouldn't be advertising for them, you'd be informing us of options.
Well, well, I can tell you who it is. It's Blue Cross Blue Shield of Michigan. Now,
Thank you.
I don't know how connected they are, like say Blue Cross Blue Shield of Wisconsin, how connected they are as far as what they pay.
Our Blue Cross used to be nonprofit and now it isn't.
It's
and we
kind of
have had,
semi-nonprofit.
pardon me?
It's kind of semi-nonprofit.
Well, their CEO makes tons of money, and some of us were in front of the Blue Cross office in Lansing with signs saying how much he made and the connection to our governor in her campaign. I can't remember what group I was with. I think it might have been DSA, not Green Party that time.
Yeah, it looks like Sandy has her hand up.
Yeah, Sandy, go ahead.
I was just gonna ask Jim, I asked in the chat, but he probably didn't see it. Is your Blue Cross through a current or former employer? I had Blue Cross and it was wonderful, but then I retired and now I have a Medicare disadvantage plan.
Yeah,
Because that's what my union negotiated. That's what I had to take.
yeah. Actually, my employer did have Blue Cross Blue Shield as part of our system. When they went bankrupt, of course, I lost it. Had to go with, and I can't think of what it is, the ungodly health insurance company that charges ridiculous price.
Cobra?
I'm sorry?
Cobra?
Cobra, yes. But once I went on Medicare, I went to an organization, an office that helps people gather their health insurance. And they set me up with Blue Cross Blue Shield. And fortunately, I was enrolled in what was called a legacy plan, which was fairly inexpensive at the time. And I'm still grandfathered into that, even though the cost has gone up immensely. I think that's probably why everything's getting paid for by, paid for me by them, because of this legacy grandfather and clause.
But you do have a premium, correct?
Yeah.
It's not premium free, is it?
No, it's not premium free. I still have to pay a premium.
Okay, so is it your Medicare Part B? I know I'm being personal, I'm just curious. If you don't want to answer, that's fine. Is it a Medicare plan? Is it your Part B premium from your Social Security check?
let's see.
Guys, I'm
It's
thinking we
either
should probably have one more
B
question.
or
then
C,
we have-
whichever is the supplemental insurance. I can never keep them straight, B or C.
Okay. I was just curious.
We have time for maybe, sorry, I bet you anything it's part F, which is more expensive, but that covers overage and the copay for part B. You can't get it unless you have, like, I squeaked in by a less than a month. But part G doesn't cover part B copay, but it does cover overage, and you definitely want that or you're in big trouble. Sorry, just had to pop in. So yeah, Skip or I didn't get the name. I'm sorry, I didn't get your wife's name, but
Jasmine,
was
so
that?
what I don't understand in all that is what I hear so often as somebody who comes from outside is it was always like that. And when I say, well, but it was always shit then, this healthcare system is shit. Sorry to say, but that's how I experienced it. Then yeah, maybe it's shit, but it was like that always. And I really would like to mobilize people into action against that. If you would change in Germany the system into the system that exists here, there would be strikes, there would be demonstrations on every day in front of the parliament in Berlin. You can be sure we would freak out.
That's
And
why, like
here,
they did in
and
France
here
about
it's
the
like,
retirement
well,
age.
it was always like that.
No, it wasn't.
Yeah.
Don't think so. Not. I know that originally those programs actually went much farther than they do today. That's just kind of eroded. And then with the privatization and increasing costs and stuff, that's one thing. But and one more final thing, we have people needing to go to another call. But by the way, thanks. I just want to say to everybody who pitched in here, this is an extremely informative and helpful thing. Jim, I'll turn this back to you then.
Okay, yes, thank you. And thank you everyone for participating in our first Medicare webinar. We hope you've learned some more things about what it is like to go through the work and work with the system, which is quite a system. I also especially want to thank our team behind the scenes, detailer, timekeeper, Starlene Rankin, technology manager, Holly Hart, chat manager, and our co-chair, Jackie Devenow. Thanks again for joining us and making our first webinar a success. We appreciate each and every one of you. On behalf of the Green Party elders, we thank you very much and look forward to upcoming part 2 of our healthcare webinar, looking possibly in May.